Hey everyone, welcome back, or if you're just joining us, welcome to KSSP Podcast. I'm Spencer.
And I'm Katie. Today we're going to just be going over a little bit more general information about drug safety, a little bit about overdoses, and then ratios of effective doses to fatal doses. That's what we'll be discussing today.
And we'll start with just some general overdose information. So, when you're calling 911, what typically will the operators want to know? So, they will want to know what drugs did the person take, and can you locate the drug's container? How much of the drug did the person take? When did the person take the drug? Was the drug taken with alcohol or any other medications or chemicals? What is the age of the person? What symptoms is the person experiencing? Is the person conscious? And is the person breathing?
So determining a drug overdose may be a symptom-based process. However, the drug may do extensive damage to the body before significant symptoms develop. So, different drugs have varying effects on the body's acid/base balance and certain blood elements like potassium and calcium. Blood tests may be used by medical professionals to detect changes in the chemistry of the body that may help to determine what drugs the patient took. Doctors may also test for various drugs in the patient's system. Once doctors identify which drugs caused the overdose, blood tests monitor how fast the drug clears out of the patient's system. Urine analysis can also be administered to test for certain drugs and detect changes in chemistry of the body. Blood and urine tests may also show damage to the liver or kidneys due to the overdose. So, we're going to look at some numbers here. We've shown these charts before, but we're going to go over them once again. These are the ratios of effective doses to fatal doses and dependency levels of each drug. So first, let's go to our images here. The ratio of fatal dose to effective dose. So what this means is the fatal dose is obviously the fatal dose, the dose that causes overdose. The effective dose is the dose it takes to get you inebriated. So what this ratio means is that, for example, with marijuana, let's look at that one. So it says over 1,000. So this means that if one dose gets you inebriated, it would take over 1,000 doses to cause an overdose. That would be about 1,000 for LSD and psilocybin, or magic mushrooms as they're known as well. And then nitrous oxide, one effective dose is compared to 150 as a fatal dose. Kava is 75. Dimethyltryptamine is 1 to 50. Ketamine is 1 to 38. Rohypnol is 1 to 30. Mescaline is 1 to 24. Codeine is 1 to 20. MDMA is 1 to 16. Cocaine is 1 to 15. Alcohol and dextromethorphan are 10. And I believe methamphetamine is on that level as well. And then GHB is 1 to 8. Isobutyl nitrate is 1 to 8, as is datura. And then nutmeg is 1 to 7. And heroin intravenous is 1 to 5. So then they label here less lethal than alcohol and more lethal than alcohol. Although for some of these, I'd be curious about other methods of, other routes of administration. I'd be curious to see for a couple of these. And then the next chart we're going to go over here is the safety ratio and dependence of potential drugs. So let's see. Heroin, the effective dose, if the effective dose is 8 milligrams, the lethal dose is 50, and the safety ratio is 6. Dependence potential is very high. For morphine, effective dose is about 20 milligrams and lethal is 300. Safety ratio is 15 and dependence potential is high. With barbiturates, such as pentobarbital, 250 milligrams is an effective dose, and then 5 grams would be the lethal dose. So the safety ratio is 20 and dependence potential is moderate to high. Benzodiazepines, such as rohypnol, the effective dose would be 1 milligram, lethal dose would be 30, the safety ratio is 30, and dependence potential is moderate. With alcohol, ethanol, the effective dose is 30 milligrams, then the lethal dose would be 300, and the safety ratio is 10. So dependence potential is moderate. Stimulants, caffeine, effective dose is 100 milligrams, the lethal dose is 10 grams, and the safety ratio is 100. So that dependence potential is moderate to low. Cocaine, effective dose would be 80 milligrams, lethal dose would be 1.2 grams then. So the safety ratio is 15, and dependence potential is moderate to high. Ephedra, 25 milligrams effective, lethal is 3.5 grams, safety ratio is 140, and dependence potential is moderate. MDMA, effective dose is 125 milligrams, lethal dose is 2 grams, safety ratio is 16, dependence potential is moderate to low. Nicotine, effective dose is 1 milligram, then the lethal dose is 50 milligrams, so the safety ratio is 50, and dependence potential is high. Ketamine, the effective dose is 70 milligrams, lethal dose is 2.7 grams, and safety ratio is 38. Dependence potential is low. Nitrous oxide, effective dose is 3.5 liters, lethal dose is 525 liters, safety ratio is 150, and dependence potential is moderate to low. Then LSD, 100 micrograms is the effective dose, 100 milligrams is the lethal dose. So the safety ratio is 1,000, and that's a very low dependence potential. And then mescaline, effective dose is 350 milligrams, then the lethal dose would be 8.4 grams, and the safety ratio is 24. Dependence potential is very low. Psilocybin, effective dose 6 milligrams, lethal dose 6 grams, a safety ratio of 1,000, and the dependence potential is very low. And finally, we have cannabis. So marijuana, 15 milligrams would be the effective dose, then more than 15 grams would be the lethal dose. And the safety ratio is 1,000, and dependence potential is moderate to low. Now, of course, this is going to depend on a couple things. So your tolerance, for one. If your tolerance is higher, you're going to have a higher effective dose and a higher lethal dose. And the other thing is people also will just vary from person to person in general with their tolerance as well. So some people will naturally have a higher or lower tolerance than others. These are just, I assume these are averages here. I don't know how else you would determine the dose for each individual person. So, yeah. Those are the safety ratios and dependence of potential drugs. So, yeah.
Now that we've discussed some general drug safety tips and we went over overdose as well, join us in our next video as we give our concluding thoughts. And as always, you can leave a comment below if you have any topic ideas that you would like us to discuss in future episodes.
Yeah, you can reach out to us on Facebook, and YouTube, Instagram, TikTok, or Twitter. And we also occasionally do Twitch live streams, so make sure to follow us there so you can be notified when we do.
And don't forget to give this video a like, as well as follow or subscribe to our other social media accounts and turn on notifications on those so that you get notified when our new content comes out. Otherwise, we will see you all in the next video.